Question 1. A healthcare facility has recently implemented a new system for collecting patient health data, including electronic health records, AIS, surveys, and claims data. However, the organization is struggling to integrate these various data sources efficiently. What is the most effective method for ensuring that the different data sets can be used together seamlessly? A. Data encryption. B. Data normalization. C. Data mining. D. Data retention. Explanation. Data normalization is the process of organizing data in a way that ensures consistency across different datasets, allowing for easier integration. In this case, the different data sources, as surveys and claims data, are collected in potentially diverse formats and structures. Normalization standardizes the data to a common format, making it compatible for integration and analysis. This process helps eliminate redundancy, ensures accuracy in data analysis. While encryption is essential for data security, it does not address integration. Data mining (C) refers to analyzing large datasets for patterns and trends, but does not directly solve integration issues. Data retention (D) relates to how long data is kept, which is unrelated to integration of different data types. Question 2. Mr. Thompson is a data analyst at a health insurance company. He is tasked with conducting a risk adjustment analysis for a new population health management initiative. He notices that the health outcomes for certain groups of patients appear to be skewed due to varying demographic factors such as age, socioeconomic status, and underlying chronic conditions. What should Mr. Thompson do to adjust the analysis to account for these variables? A. Use a survival analysis model to adjust for demographics. B. Apply a regression model with risk adjustment factors. C. Increase the sample size to reduce variability. D. Conduct a simple descriptive statistics analysis for each group. Answer. B. Apply a regression model with risk adjustment factors. Explanation. A regression model with risk adjustment factors is the most appropriate tool to adjust for demographic variables such as age, socioeconomic status, and chronic conditions. These factors can significantly skew health outcomes if not accounted for, and a risk adjustment model, such as a logistic or linear regression with appropriate control variables, allows for the analysis. Provide a more accurate representation of the health outcomes across different patient populations. Survival analysis would be more useful for analyzing time-to-event data, and simply increasing the sample size C would not correct for the bias introduced by demographic disparities. Descriptive statistics D would not adjust for the confounding variables, as they are more for summarizing data rather than adjusting for confounding factors. Question 3. Which of the following is a key requirement under the Health Insurance Portability and Accountability Act, HIPAA, for ensuring the security and confidentiality of health data? A. Data retention policies. B. Encryption of health data during transmission. C. Air system interoperability. D. Population health management. Answer. B. Encryption of health data during transmission. Explanation. Under HIPAA, safeguarding the confidentiality and security of health information is paramount. Encryption of health data during transmission (B) ensures that sensitive health information is protected while being transmitted between systems, preventing unauthorized access. This is a critical measure to comply with HIPAA's privacy and security rules, which mandate that health data must securely transmitted to avoid breaches of patient confidentiality. Data retention policies are important but are not specifically required by HIPAA in terms of transmission security. Air system interoperability (C) is goal for efficient healthcare data exchange but does not directly address data security during transmission. Population health management (D) is related to data analysis but does not involve the security of health data itself. Question 4. In the context of healthcare data analysis, you are working with a dataset containing patient health information, including diagnoses, procedures, and medication prescriptions. The dataset is sourced from multiple hospitals across the country, each using different coding systems for diagnosis IC9, IC10, and procedures EECs. To analyze this data efficiently, you need to integrate it into a common system. Which would you take to standardize the codes and ensure comparability across the different sources? A. Use data normalization techniques to standardize codes into a single format. B. Apply a machine learning model to map and convert the codes automatically. C. Merge the datasets without standardizing codes and analyze them as they are. D. Remove any data that cannot be converted to the common code system. Answer A. Use data normalization techniques to standardize codes into a single format. Explanation. Data normalization techniques are crucial in this case as they allow for the conversion of different coding systems, IG9, ICTE, a single standardized format that enables efficient integration and analysis. This helps ensure comparability across datasets from different hospitals. Machine learning B can assist in them process, but data normalization is the systematic way to standardize codes and prepare them for analysis. Merging the datasets without standardizing C could lead to inconsistencies and difficulties in drawing meaningful conclusions. Removing data D would result in loss of valuable information and is not a practical approach. Question 5. A hospital's data governance committee is tasked with ensuring the quality and integrity of health data used for clinical decision-making. They are currently reviewing how to improve the accuracy, consistency, and timeliness of data being captured. Which of the following strategies would most directly address the improvement of data quality management? A. Implementing strong data encryption protocols. B. Establishing a metadata management framework. C. Developing policies for data access control. D. Adopting a robust data governance framework. Answer D. Adopting a robust data governance framework. Explanation. A robust data governance framework D is essential to ensure the accuracy, consistency, and timeliness of data, which are key components of data quality management. A data governance framework defines the processes, roles, and responsibilities required to manage data quality and integrity across an organization. This framework ensures data is handled correctly at all steps, from collection to storage and analysis. While encryption protocols A. protect data security, they do not directly influence data quality. Metadata management B. focuses on managing information about data, but it is part of a larger governance framework. Access control policies C. are important for security but do not directly improve the quality of the data itself. Question 6. A healthcare organization has adopted electronic health records as store patient data and improve clinical workflows. However, the organization is facing challenges with interoperability as their AI system is not effectively communicating with other hospitals' AI systems. What should the organization prioritize in order to resolve this interoperability issue and facilitate data exchange between systems? A. Ensuring compliance with HIPAA security regulations. B. Implementing HL standards for data exchange. C. Increasing the number of patient records stored in the system. D. Updating their database management system to include SQL support. Answer B. Implementing HL standards for data exchange. Explanation. HL standards B. are the recognized protocols for enabling interoperability between different AI systems. These standards define the structure and encoding of electronic health data, ensuring seamless communication across different platforms. Compliance with HIPAA is crucial for securing data but does not directly address interoperability. Increasing records C. may not resolve the core issue of system compatibility. While SQL support D can improve database performance, it is not a solution for the lack of interoperability between different AI systems. Question 7. Dr. Garcia is analyzing the clinical outcomes of diabetic patients across several healthcare facilities. She notices that the risk of complications is significantly higher in certain patient populations, such as elderly patients or those with low income. To better understand these disparities, Dr. Garcia should perform an analysis that accounts for these demographic variables. Which type of analysis would best allow Dr. Garcia to for these confounding factors? A. Descriptive statistics analysis. B. Survival analysis with a focus on time to event data. C. Multivariable regression analysis with demographic variables as covariates. D. Data clustering based on patient characteristics. Answer. C. Multivariable regression analysis with demographic variables as covariates. Explanation. Multivariable regression analysis C is the most appropriate method for adjusting for confounding demographic variables such as age, income, and other risk factors. By including these demographic factors as covariates in the model, Dr. Garcia can account for their effects on the clinical outcomes and isolate the impact of other variables. Descript statistics A only summarizes data and does not adjust for confounding factors. Survival analysis B is useful for time to event data but may not be the most appropriate approach for adjusting for demographic variables unless time to event is a key component. Data clustering. D helps group similar patients but does not specifically adjust for confounding factors in the analysis. Question 8. You are conducting a study on patient satisfaction and the relationship between healthcare services and clinical outcomes. The dataset you are working with contains various patient-reported outcomes, PROs, and clinical data, but you need to develop a statistical model that can predict patient satisfaction based on clinical factors like treatment type, physician communication, and hospital facilities. Which type of model would be appropriate for predicting a continuous outcome such as patient satisfaction? A. Logistic regression. B. Linear regression. C. Cox proportional hazards model. D. Naive Bayes classifier. Answer: B. Linear regression. Explanation: linear regression B is the most appropriate model for predicting a continuous outcome like patient satisfaction. This method models the relationship between the dependent variable satisfaction and independent variables treatment type, physician communication, etc. using a linear equation. Logistic regression A is used for binary outcomes, e.g. satisfied versus not satisfied, so not be suitable for continuous outcomes. The Cox proportional hazards model C is used for time to event data and would not be applicable in this case. Naive Bayes D is a classification model used for categorical data, making it unsuitable for continuous outcome prediction. Question 9. As part of a quality improvement initiative, your healthcare organization has implemented a new predictive analytics tool to identify patients at high risk of readmission within 30 days after discharge. The tool uses various data points such as previous hospitalizations, comorbidities, and medication adherence. To evaluate the tool's performance, which of the following metrics should be most useful in assessing its predictive accuracy? A. R-squared value. B. Sensitivity and specificity. C. Data standardization score. D. Data encryption rate. Answer: B. Sensitivity and specificity. Explanation: sensitivity and specificity B are essential metrics for evaluating the performance of a predictive model, particularly in a healthcare setting. Sensitivity measures the proportion of true positives patients correctly identified as high risk, while specificity measures the proportion of true negatives patients correctly identified as not high risk. These metrics give a comprehensive view of the accuracy in predicting remissions. R-squared A is commonly used for regression models, but it is not ideal for classification tasks like predicting high-risk patients. Data standardization C and encryption rate D are not metrics used for evaluating the predictive accuracy of a model. Question 10. A health data analyst is tasked with preparing a report on the performance of a healthcare program aimed at reducing the incidence of heart disease in a community. The program's success is to be measured by comparing the rate of heart disease in the community before and after the program was implemented. To ensure the report provides actionable insights, what type of analysis should the analyst use to determine if the program had a significant effect on heart disease rate? A. Paired t-test. B. Chi-square test. C. Time series analysis. D. Multivariate analysis of variance maneuver. Answer: A paired t-test. Explanation: a paired t-test is the most appropriate statistical method for comparing two related groups, such as heart disease rates before and after the program. It tests whether the mean difference between the two time points is statistically significant. The chi-square test B is used for categorical data and is not suitable for comparing continuous variables like heart disease rates. Time series analysis C is useful if there is a need to account for trends over time, but the paired t-test is more focused on comparing two specific points in time. ANOVA D is used when comparing multiple dependent variables, which is not necessary in this case. Question 11. You are tasked with analyzing patient outcomes for a new diabetes treatment program. The dataset includes various patient characteristics such as age, gender, treatment adherence, and medical history. You wish to determine which factors most significantly influence patient recovery. What type of analysis would be most appropriate for identifying the relationship between multiple independent variables such as age, gender, treatment adherence, and a continuous dependent variable such as recovery score? A. Logistic regression. B. Multiple linear regression. C. One-way ANOVA. D. Chi-square test. Answer: B. Multiple linear regression. Explanation: multiple linear regression B is used when analyzing the relationship between multiple independent variables and a continuous dependent variable. In this case, you are looking to understand how patient characteristics such as age, gender, and treatment adherence influence the recovery score, which is continuous. Logistic regression is used for binary outcomes, while one way and over C. Comparing means across different groups and is not suitable for multiple independent variables. The chi-square test D is used for categorical variables, which does not fit this situation. Question 12. A healthcare provider is evaluating the effectiveness of a new medication on reducing symptoms of chronic pain. The study involves a randomized control trial RET with a treatment group and a control group to measure the impact of the medication the provider uses, a pre- and post-treatment assessment. What statistical tests should be used to compare the means of the two groups before and after the treatment? A. Paired t-test. B. Two-sample t-test. C. Analysis of covariance and cover. D. McNemer's test. Answer A. Paired t-test. Explanation. The paired t-test is appropriate because it compares the means of the same group before and after an intervention pre and post-treatment. Since the same patients are being assessed at two different points in time, the data is paired. A two-sample t-test B compares two independent groups, which is not applicable here, and cover C adjusts for covariates, but is more useful when comparing groups with different characteristics. McNemer's test D is used for paired nominal data and would not apply to this continuous outcome. Question 13. You are analyzing a dataset that includes health insurance claims data from several regions. You notice that there are a significant number of missing values for patient age and insurance plan type. What is the most effective way to handle missing data in this context to ensure that your analysis remains valid? A. Remove all rows with missing data. B. Replace missing values with the median or mode of the variable. C. Ignore the missing data and continue with the analysis. D. Use the mean of the variable to replace missing values. Answer. B. Replace missing values with the median or mode of the variable. Explanation. Replacing missing values with the median for continuous variables or mode for categorical variables is an effective method to handle missing data, especially when the amount of missing data is small. This method ensures that you don't lose valuable information by excluding entire rows. Simply removing rows with missing data can result in bias if the missing data is not missing at random. Ignoring missing data C compromises the validity of the analysis, and using the mean D is less effective for skewed distributions or categorical data. Question 14. A hospital is implementing a new clinical decision support system CSS to assist physicians in diagnosing diseases based on patient symptoms. You need to evaluate the effectiveness of the CSS in improving diagnostic accuracy. Which evaluation method would best measure whether the CSS increases diagnostic accuracy compared to traditional methods? A. A/B testing. B. Cross-sectional study. C. Cohort study. D. Pre-post study. Answer D. Pre-post study. Explanation. A pre-post study D is the best evaluation method when assessing the impact of an intervention like the CSS before and after its implementation. This approach allows you to compare diagnostic accuracy before and after the CSS is introduced. The B testing is typically used for comparing two alternatives, but it is not ideal for assessing long-term impact. A cross-sectional study B data at one point in time and would not show the changes over time. A cohort study C tracks individuals over time but is better suited for observing outcomes based on exposure to a risk factor, not for evaluating a new intervention. Question 15. You're working with a health data analytics team to predict patient remission risks for a specific disease. The dataset includes a variety of features such as medical history, age, gender, and previous admissions. You have chosen to use a machine learning model for prediction. Which machine learning algorithm would be most appropriate for this classification task? A. K-means clustering. B. Support vector machine SVM. C. Random forest. D. Principal component analysis PC. Answer C. Random forest. Explanation. Random forest C is a powerful machine learning algorithm suitable for classification tasks like predicting patient remission risks. It builds multiple decision trees and aggregates their results to improve prediction accuracy and handle complex data. K-means clustering is an unsupervised learning algorithm used for grouping similar data points, not for classification support vector. SVM B is a good classification algorithm, but may not perform as well on large datasets with many features. PCA-D is a dimensionality reduction technique, not a classification algorithm. Question 16. A healthcare provider wants to assess the impact of a new health education program on reducing smoking rates among adolescents. To analyze the program's effectiveness, the provider compares smoking rates before and after the program among adolescents who participated. What type of statistical test should be used to compare smoking rates at the two different time points? A. Paired t-test. B. Two-sample t-test. C. Chi-square test. D. Wilcox-Signed rank test. Answer A. Paired t-test. Explanation. The paired t-test is the correct statistical test when comparing the same group before and after an intervention, in this case, smoking rates before and after the health education program. This test accounts for the fact that the data are related as the same adolescents are being measured at both time points. The two-sample t-test B is used for independent groups and would not be applicable here. The chi-square C is used for categorical data, and the Wilcox-Signed rank test D is a non-parametric alternative to the paired t-test used when the data does not follow a normal distribution. Question 17. In a clinical trial to assess the effectiveness of a new pain medication, researchers measure the pain levels of participants at 3 time points before treatment, 1 week after treatment, and 1 month after treatment to determine if there are significant differences in pain levels over time. Which statistical method should be used to compare the repeated measures? A. Repeated measures ANOVA. B. Simple linear regression. C. 2A ANOVA. D. Paired t-test. Answer A. Repeated measures ANOVA. Explanation. Repeated measures ANOVA is the most appropriate statistical method for analyzing data collected at multiple time points from the same group of participants. This test accounts for the correlation between repeated measurements on the same individuals. Simple linear regression B is used for predicting a dependent variable from an independent variable, but it does not account for repeated measurements. ANOVA C is used when there are 2 independent variables, but this is not a case of comparing 2 groups or conditions. The paired t-test D is used for 2 measurements, so it would not be suitable for 3 time points. Question 18. A health insurer is assessing the factors that influence the cost of healthcare claims. The dataset includes variables such as age, gender, medical conditions, treatment types, and hospital stays. To determine how these factors affect the overall cost of claims, which of the following statistical models would be best suited for this analysis? A. Poisson regression. B. Linear regression. C. Generalized linear model GLMM. D. Logistic regression. Answer. C. Generalized linear model GLMM. Explanation. A generalized linear model GMM-C is ideal for modeling continuous outcome variables like healthcare costs that may not follow a normal distribution. It allows you to incorporate multiple predictors, including categorical and continuous variables. Poisson regression is used for count data, so it is not suitable for continuous variables like healthcare costs. Linear regression B could be used if the data fits normal distribution, but GLM provides more flexibility for different types of data distributions. Logistic regression D is used for binary outcomes, which does not fit the cost analysis in this case. Question 19. A team of researchers is studying the relationship between diet, physical activity, and heart disease risk in a cohort of middle-aged adults. They collect data on participants' diet, physical activity levels, and other health behaviors to determine whether diet and physical activity are associated with heart disease risk. Which statistical technique would provide the most robust results? A. Multiple regression analysis. B. Chi-square test. C. Correlation analysis. D. Multivariate analysis of variance MANOVA. Answer A. Multiple regression analysis. Explanation. Multiple regression analysis is the best technique when examining the relationship between multiple independent variables, such as diet and physical activity, and a continuous dependent variable, such as heart disease risk. It allows you to assess the individual contributions of each factor while controlling for other variables. The chi-square test B is used for categorical data, which is appropriate for this analysis. Correlation analysis C measures the strength of the relationship between 2 variables, but does not account for the influence of other variables. MANOVA D is used when there are multiple dependent variables, which is not the case here. Question 20. You are tasked with evaluating the impact of A new electronic health record system on hospital efficiency. The hospital has implemented the system and wants to compare key efficiency metrics, e.g., patient wait times, discharge times, before and after the AIR system was introduced. What statistical test would you use to determine if there are significant differences in these metrics? A. Paired t-test. B. Two-sample t-test. C. Chi-square test. D. One-way ANOVA. Answer A. Paired t-test. Explanation. The paired t-test is the correct statistical test for comparing the same group, in this case the hospital, before and after the introduction of the AIR system. It evaluates whether there is a significant difference in the metrics e.g. wait times, discharge times before and after the intervention. The two-sample t-test B is used for comparing two independent groups, which is not applicable here. The Chi-test C is used for categorical data, and one-way ANOVA D is used when comparing more than two groups or categories, which is not the case in this scenario. Question 21. A healthcare organization is assessing the effectiveness of a new vaccination program for preventing influenza. They plan to compare the incidence of influenza between a group of patients who received the vaccine and a group who did not. The data is categorical, with patients classified as either ill or healthy after the flu season. Which statistical test would be appropriate to compare the incidence rates of influenza between the two groups? A. Chi-square test. B. Paired t-test. C. Independent t-test. D. Logistic regression. Answer A. Chi-square test. Explanation. The Chi-square test is the correct choice for comparing the incidence of influenza between two categorical groups, ill versus healthy. It assesses whether the frequency distribution of categories is significantly different between the two groups. The paired t-test B is used for comparing continuous variables in the same subjects before and after an intervention, which does not apply here. The independent t-C compares means of continuous variables between two independent groups, while logistic regression D is for modeling binary outcomes with continuous predictors, which is not needed in this situation. Question 22. A clinical trial is designed to evaluate the effect of a new antidepressant medication on the severity of symptoms in patients with depression. The severity of symptoms is measured on a continuous scale before and after treatment to determine whether there is a significant reduction in symptom severity due to the medication. Which statistical test would be most appropriate? A. Paired t-test. B. One-way ANOVA. C. Independent t-test. D. Chi-square test. Answer A. Paired t-test. Explanation. The paired t-test is the most appropriate statistical test when comparing the means of a continuous variable symptom severity before and after treatment within the same group of patients. The one-way ANOVA B is used to compare means across more than two groups, which is not needed here. The independent t-test C compares means between two independent groups, but both measurements in this scenario from the same group of patients. The chi-square test D is for categorical data, which is not applicable here. Question 23. A hospital is analyzing patient outcomes after surgery, including length of stay, post-operative complications, and recovery time. The researchers want to determine which factors, age, gender, surgery type, contribute most to variation in post-operative recovery time. Which statistical technique would be best suited to assess the contribution of multiple independent variables to a continuous dependent variable? A. Multiple linear regression. B. Logistic regression. C. Paired t-test. D. One-way ANOVA. Answer A. Multiple linear regression. Explanation. Multiple linear regression is ideal for evaluating the relationship between multiple independent variables, age, gender, surgery type, and a continuous dependent variable, post-operative recovery time. Logistic regression B is used for binary outcomes and is not appropriate here. The paired t-test C is used for comparing pre- and post-treatment measurements within the same, while one-way ANOVA D compares means across different groups and is not suited for examining multiple independent variables simultaneously. Question 24. A research team is conducting a study on the factors that influence the adherence to treatment among patients with chronic diseases. They collect data on factors such as socioeconomic status, education, and access to healthcare. The team wants to predict the likelihood of a patient adhering to treatment based on these factors. Which machine learning algorithm would be most appropriate for this classification problem? A. K-means clustering. B. Decision tree. C. Linear regression. D. Naive Bayes. Answer B. Decision tree. Explanation. A decision tree, B, is an appropriate machine learning algorithm for classification tasks, especially when predicting binary outcomes, e.g. adherence to treatment, yes or no. It splits the data based on feature values to make decisions and is interpretable. K-means clustering, A, is an unsupervised learning algorithm used for clustering data, not classification. Linear regression, C, is used predicting continuous outcomes, not binary classification. Naive Bayes, D, could also be used for classification but is less interpretable than decision trees for this type of task. Question 25. A health organization is analyzing the effectiveness of a public health campaign to reduce smoking rates among adolescents. They compare smoking rates before and after the campaign in different geographic regions. The smoking data is collected as a percentage in each region, and there are multiple regions to compare. What statistical test would be most appropriate to compare the smoking rates across different regions before and after the campaign? A. Paired t-test. B. 2A ANOVA. C. Chi-square test. D. Repeated measures ANOVA. Answer: B. 2A ANOVA. Explanation: 2A ANOVA B is suitable for comparing smoking rates across multiple groups, regions, and at multiple time points before and after the campaign. It allows for the analysis of the interaction between the two factors, region and time, and determines if there is a significant difference in smoking rates based on these factors. The paired t-test is used when comparing two measurements within the same group, but there are multiple regions and multiple time points. The chi-square test, C, is for categorical data and is not appropriate for comparing percentages. Repeated measures ANOVA, D, is used when there is only one group with repeated measurements, which is not the case here. Question 26. A hospital is looking to predict the risk of heart disease in patients based on factors such as age, cholesterol levels, blood pressure, and smoking status. The outcome variable, risk of heart disease, is binary, present or absent. Which machine learning algorithm would be most appropriate for predicting the risk of heart disease in this scenario? A. Logistic regression. B. Linear regression. C. Support vector machine SVM. D. K-nearest neighbors KNN. Answer: A. Logistic regression. Explanation: Logistic regression is the best choice for predicting binary outcomes such as the presence or absence of heart disease. It models the relationship between the predictor variables, age, cholesterol, etc., and the probability of an event occurring. Linear regression, B, is for continuous outcomes and would not be appropriate for a binary outcome. Support vector machines SVM, C, can also be used. Binary classification, but logistic regression is simpler and more interpretable in this context. K-nearest neighbors, KNN-D, is a non-parametric classification algorithm that can be used but is less efficient and interpretable than logistic regression for this task. Question 27. A research study is being conducted to assess whether there is a relationship between physical activity levels and the incidence of heart disease in a cohort of middle-aged adults. The study involves collecting data on physical activity measured in hours per week and heart disease diagnosis, yes/no. What statistical tests should be used to determine whether physical activity levels are significantly associated with heart disease incidence? A. Pearson correlation. B. Independent t-test. C. Chi-square test. D. Logistic regression. Answer: D. Logistic regression. Explanation: Logistic regression, D, is the appropriate statistical method for determining whether physical activity, a continuous variable, is associated with a binary outcome, heart disease, yes/no. Pearson correlation is used to measure the strength of the linear relationship between two continuous variables, but here the outcome is binary. The independent t-test, B, compares means between two independent groups, not applicable to this situation. The chi-square test, C, is used for categorical data, and while it could be used for categorical outcomes, logistic regression provides a more powerful and accurate analysis for this type of binary outcome. Question 28. A team of epidemiologists is studying the effects of air pollution on respiratory health in different urban areas. They collect data on air quality, measured in micrograms per cubic meter of particulate matter, and the incidence of asthma in children. To assess the relationship between air quality and asthma, they want to account for other factors such as socioeconomic status, parental smoking, and access to healthcare. Which statistical method would be most appropriate for controlling for these confounding variables while assessing the relationship between air quality and asthma? A. Multiple linear regression. B. Paired t-test. C. Stratification. D. Analysis of covariance and ANCOVA. Answer: D. Analysis of covariance and ANCOVA. Explanation: Analysis of covariance and ANCOVA D is appropriate when you want to assess the relationship between a continuous independent variable, air quality, and a dependent variable, incidence of asthma, while controlling for other confounding variables, socioeconomic status, smoking, etc. It allows for the adjustment of these covariates in the analysis. Multiple linear regression they could also used within COVA is specifically designed to handle the type of analysis described here. The paired t-test B compares two related groups, which is not applicable here, and stratification C is a simpler method for adjusting for confounding but may not be as efficient in dealing with multiple variables. Question 29. A hospital wants to predict the likelihood of patient readmission within 30 days after discharge based on demographic factors, medical history, and previous admissions. The data is collected for a large number of patients, and the hospital is interested in using machine learning to make predictions. What machine learning algorithm would be most appropriate for predicting the probability of readmission? A. Decision tree. B. K-means clustering. C. Logistic regression. D. Linear regression. Answer: C. Logistic regression. Explanation: Logistic regression C is the best machine learning algorithm for predicting a binary outcome like patient remission, yes or no. It estimates the probability of an event occurring based on the input variables, demographic factors, medical history, etc. Decision trees could also be used, but logistic regression is more commonly used for predicting probabilities in binary classification tasks. K-means clustering. B is an unsupervised learning algorithm used for clustering, not classification. Linear regression. D is used for continuous outcomes, not binary ones. Question 30. A public health agency is analyzing the impact of a new smoking cessation program. They track participants' smoking behavior at 3 time points: before the program, immediately after the program, and 6 months after the program, to assess whether there is a significant reduction in smoking over time. Which statistical method would be most appropriate? A. Paired t-test. B. Repeated measures ANOVA. C. Chi-square test. D. Independent t-test. Answer: B. Repeated measures ANOVA. Explanation: Repeated measures ANOVA B is the most appropriate statistical method for analyzing data collected at multiple time points from the same group of participants. It allows for the evaluation of changes in smoking behavior over time and accounts for the correlation between repeated measurements. The paired t-test is used for comparing 2 time points, not 3. The chi-square test C categorical data in the independent t-test. D compares 2 independent groups, which is not applicable here.